Yeah. I mean tomorrow?
Yeah.
Oh, okay, yeah.
I'll let you know.
Let me put it on the board. Some kinds of foreheads. I have the list, so I just hold on to it. But I'll put Linda on there.
Okay. Those are here.
Right.
What?
So that's 0 active cases. Well, that was interesting. I just got kicked out and now I'm back. So let me add the presentation back in. Okay, so where we left off. We left off on the community update for COVID-19, and currently, like I was trying to report out earlier, the active case count for the community is where we'd like it to be, which is at 0, with 0 cases in the past 7 days and no new cases today. So the total case count since the beginning of the pandemic is 308, with 306 total recovered. The state of New Mexico is looking pretty decent as well. Yes, they still have quite a few active cases, but we have single-digit individuals that are on ventilators, and the current hospitalizations are less than 184. With 4 new deaths reported yesterday, bringing the state's death total to 8,497 not dollars, 97 people. One of the things that are significant on this report from the New Mexico Department of Health dashboard is the number of tests that are reported to the state. The reason why we are still wanting to stay as careful and cautious as we could is because we know that because the test numbers are more than likely an undercount because of the number of home tests that are being administered throughout the state. But as a result, the case count is going to be not accurate, because if tests are not being reported, then the cases are also going to be unreported. The hospitalizations and deaths may be a little bit off, but that's because that's reported by medical facilities. That is probably a more accurate and a more clear interpretation of the COVID-19 status in the state of New Mexico. So, with that being said, we're looking at the dashboard for the COVID cases for the different counties. It seems like each week we come back, we're having more and more counties in the yellow, which means the community transmission rate is decreasing across the state. Santa Fe County is, yes, still in the red, and so is Rio Arriba County and Los Alamos County, which are the counties that are surrounding us. So we still have to be somewhat careful because there is still considered a higher transmission rate in the counties that we are in and that are around us. Still, we're still pushing the COVID safe practices just to make sure that everybody is doing what they can to keep themselves safe and the communities that are around them that they live in safe. We do know that the more positive cases that there are in the local area, and the number of people that remain positive for significant periods of time, it gives the virus more opportunity to mutate and make things more difficult on us to manage things based on our current um, protection levels, whether it be from prior infection or from vaccination. So, just wanted to put that back up on the screen so people are aware that these things are still being recommended. They are still considered the COVID safe practices, and we need to do what we can to keep people and ourselves safe. Um, Before I do the normal, if you have any questions thing, I wanted to put up today's activity at today's event, um, the vaccination clinic that we're having today here at the Pueblo. One of the good things about being able to have partners in the community that are willing to come out and provide support for the community and give us opportunities to keep ourselves safe. The New Mexico Department of Health has come through again, and they have set up two vaccination clinics, one being today. So if you all are out there are looking to get your Omicron specific booster or your primary series, if you've never gotten the primary series, or if you have young people under the age of 12 that have not gotten their vaccination, especially those that are 6 months and older, all of the vaccinations that are available through Pfizer and Moderna will be available at the vaccination clinic today. So if you have signed up, of course, that is a good thing. We have probably over 70 people that are signed up for the vaccine clinic. If it gets closer to 6 o'clock or 5 o'clock in the afternoon, and you feel like you want to call us and see if we have space to fit in more people, you can definitely do so. It doesn't mean that we will have any openings for you to come in, but we can also try to squeeze some people in based on the number of people that have shown up and the number of vaccines that we still have remaining for each of the categories of vaccine. So call the COVID response team at 505-252-5986 between 3 o'clock and 6 o'clock, or actually 3 o'clock and 5 o'clock, and we can see if we can fit you in. But the vaccine clinic is today. It's at the senior center. It's from 3. It starts at 3 o'clock. It ends at 6. So show up if you are scheduled. With that being said, just like always, if you have any questions or concerns about COVID or anything else Health and Human Services related, you can contact us at the COVID hotline number 505-252-5986, or send us an email at covid@sanipueblo.org. Or if one of the CHRs or Raylene are out doing a home visit, you can always ask the questions when they are with you. Other than that, it's time for any program updates that might be relevant from the folks that are on from the team. So if you have anything, guys, go ahead and put it out there.
Good morning, San Ildefonso. Raylene Martinez here. I would like to remind you all that we do have a few activities coming up in about 2 more weeks. We do have a acupuncture event on September 28th. It'll be at the Senior Center living room, and it'll be from 10 a.m. to 2 p.m. And we would like for people to please call in for appointments. That way, one, you're not waiting around, and two, to avoid people from kind of hanging out, I guess. Please call the COVID hotline to go ahead and make an appointment for that. This is in collaboration with Table Roots from Nambe. Also, would like to remind you, or not remind you, but we scheduled a specialty bread making for September 29th, which is the following day. It'll begin at 6 o'clock to 7:30. And so if you're interested in that, please come by. You don't have to inform us that you'll be here. You can just show up, but it'll be here at the Senior Center living room, and it'll start at 6 p.m. And I believe that's it.
I just wanted to announce that they're having the free produce today from 12:30 to 2:30 for anyone, and it's under the big tree. Dama will be there. Thank you.
Like I said, it's from 12:30 to 1:30. The free produce distribution. So, like I said earlier, it's going to be a short and sweet presentation. We don't have much to do. We are doing a lot to plan to get this vaccination event up and running. So we're not going to spend too much time on here. So there doesn't seem to be anybody logged in right now. So it would probably be wise, if none of the team members have anything else, for us to get back to doing what we do best, which is trying to serve the community the best we can and get folks vaccinated and protected. So if you are signed up for the vaccination event, please show up. No earlier than 2:45 and no later than 5:50. Actually 5:45, because there's a 15-minute observation period after your vaccination. So if you can be here, if you're registered, go ahead and show up. We'll be outside waiting for you. And Claudia, Raylene, Thelma, if you don't have anything else, we can get back to work. See everybody later, and we're done.